Good morning and thanks for joining us in the WVLT newsroom. I'm Harry Sullivan. A couple things we want to talk about concerning COVID-19, specifically first the Omicron variant and one of the newest studies coming out of Johannesburg in South Africa where the Omicron variant was first detected. Essentially, what these researchers are showing is that the Omicron variant is higher transmissible, more transmission rates than what we saw with the Delta variant. The good news is that it is much less severe than what we saw with the Delta variant. Now, in terms of Pfizer, we'll get in a little bit deeper into them in terms of the pill that they have just come out with, but the Pfizer vaccine so far seems to offer less defense against infection with the Omicron variant, but it does still help prevent that hospitalization. These findings are preliminary. They have not been peer reviewed, that's the gold standard, right, in scientific research, is that peer review, but they do line up with other data about Omicron's behavior and that it seems to be more easily transmitted. In London right now, Omicron quickly becoming the major strain of COVID-19 that is infecting the country. China starting to see a much higher case count of Omicron variants. As far as Pfizer, they're coming out today saying that their experimental COVID-19 pill actually cuts the risk of hospitalization or death by 89%. Those results came from a study where the pills, it's called Paxlovid, given to nearly 700 unvaccinated people 3 days after they started to get some symptoms. 5 of them did have to be hospitalized. No one died in this test of about 700 unvaccinated people who all got COVID. Once again, they gave it to them about 3 days after they started to get those symptoms. And that's really what we've heard has been kind of the breaking point in the number of days. They're saying, the earlier you can get to the hospital, start to get a little treatment, the higher your chance of survival is. And it's really those first couple of days that are very important. So them giving this pill 3 days after someone's been infected and started to show those symptoms is a big improvement. That it will prevent death is what they're saying, is what Pfizer has come out to say. Out of that same group, the 700 people, 44 received a placebo, out of that same group, the ones that did receive a placebo, 44 people were hospitalized, 9 people died. Once again, that's the group that got the placebo, not the actual Paxlovid Pfizer pill. The company has asked the FDA for emergency use authorization. The FDA has not yet set a date to discuss this. Once again, the FDA has been asked. They have not set a date yet. The Biden administration last month announced that it would buy 10 million 5-day courses of the drug. The government will pay more than $500 per course for a total price tag of $5.3 billion from Pfizer to get these pills produced. Pfizer says it's going to allow several lower-income countries to produce generic versions of Paxlovid that will be available to other countries across the globe at a much lower cost. But once again, if you're just now joining us, a new study coming out of Johannesburg, South Africa, where the COVID-19 Omicron variant was first discovered. Basically, kind of what we've been reaffirming what we've been hearing over the last couple of weeks, the last couple of days, spreads much more easily than the Delta variant. It is milder than the Delta variant. That, of course, very, very good news. We saw what the Delta variant did, and a lot of officials were worried that once Omicron really started to get legs and move, that it was going to be tragic. Boosters are going to be critical with Omicron. Pfizer saying that, hey, people were hospitalized with this, but the Pfizer vaccine still provides that level of protection against death to the Omicron variant. Now with this experimental COVID-19 pill, Paxlovid from Pfizer, they're saying that everyone they gave it to, 700 unvaccinated people, 3 days of symptom onset. 5 people had to be hospitalized. No one died compared to the people who were a placebo in that group. 44 hospitalized, 9 people died. So far, Omicron is in over half of the United States, half of the states in the U.S. And in Tennessee, yesterday, the news coming out that Shelby County and Memphis reporting 2 cases of the Omicron variant. But the good news, once again, it does spread easier, but it is milder than the Delta variant. Boosters are going to be critical. Pfizer and Moderna coming out saying, hey, these booster shots do protect against the Omicron variant. Not as much so with those first 2 doses that we've seen. So a lot of those boosters going to be pushed even harder over the next couple of weeks and months, especially as we're into flu season. These colder months, more people inside. That's going to be a big issue that a lot of these governments, a lot of these health organizations are going to be looking at. But once again, back to Pfizer and their experimental drug and some of the things they are working on. Cuts the risk of hospitalization or death by 89%. It's Paxlovid. That is the Pfizer experimental COVID-19 pill. They have asked the FDA for emergency use authorization. The FDA has not set a date yet to discuss that authorization. Meanwhile, the White House has already promised, or at least said, that they're willing to buy a lot, spend billions of dollars to buy some of these pills. Pfizer willing to get the lower doses, the generic versions of Paxlovid, to poorer countries that they can produce at a much lower cost to try to get that in there. 3 days after symptoms started to show is when Pfizer distributed those pills to the people in that group. 700 people, 5 had to be hospitalized. No one died from the people that got the COVID-19 Paxlovid experimental pill. So that's some very good news that we're starting to hear from Pfizer on the vaccine front and on the pill front, and some of the things that they are doing. But they are saying that if you are vaccinated and you have not got that booster, worried about Omicron, the booster will definitely help in that protection against Omicron. The 2 layers of protection from the first 2 vaccines, not as much as that booster. They have said that yes, it will help with death and keep that away, hopefully, but hospitalization still, people are being hospitalized from Omicron. But just to reiterate one more time, spreads easier. We know that about Omicron, much faster than Delta. London, right now, Omicron is becoming the primary variant that they are seeing. China starting to get swept up in Omicron as well. It is milder, though, than Delta. That is some very good news. We saw how tragic Delta was when that swept across the globe. Boosters are going to be critical when it comes to fighting Omicron and kind of getting over this new hurdle with the Omicron variant. And it is already in over half of the states in the U.S., including here in Tennessee, with yesterday Shelby County being the one to make the news that 2 cases of the Omicron variant were found. You're taking a look at our WVLT website, WVLT.tv. You can see 2 of our stories on there right now. Pfizer confirming COVID pills results, potency versus Omicron, and Omicron is milder, better at evading vaccines. That new study suggests out of Johannesburg in South Africa, where the Omicron variant was first discovered. We're going to have a lot more for you coming up on WVLT News at noon. Make sure you've got the WVLT News app, and you can check out these stories for yourself right now over on WVLT.tv and the WVLT News app. And if you have the News app, remember, we can send everything right to your phone. I'm Harry Sullivan. We will see you on WVLT News at noon. Thanks for tuning in.